Hello students, this is a lecture on Chapter 1, Head and Neck Anatomy, Essentials of Anatomy. The anatomical position is based on a person who is standing erect with their face, eyes, and feet directed forward, their arms by the side of the body, and the palms of the hands facing forward. The terms of direction are superior or cranial, which means towards the top of the head, inferior or caudal, which means towards the bottom of the feet. Medial means towards the center of the body or towards the midline. Lateral means away from the midline. Proximal means toward the midline, distal away from the midline. Anterior means towards the front. It is also referred to as ventral. Posterior means towards the back, which is also known as dorsal. Superficial means towards the surface. Deep means towards the inside part of the body. And also prone versus supine. The median plane is also referred to as the mid-sagittal plane, and it divides the body into equal left and right halves. The sagittal plane divides the body into unequal left and right parts. The frontal plane, also referred to as the coronal plane, divides the body into the front and back parts. Horizontal or transverse planes divide the body into lower and upper parts. Afferent signifies movement toward something. Efferent means movement away from something. It can refer to lymphatic, moving into the lymph node and out of the lymph node, or it can also refer to nerve impulses moving to or away from the brain. The term somatic or parietal pertains to the body wall. Some examples of somatic structures are the skin, bones, the skeletal muscle, and the wall of the body. The term visceral or splanchnic pertains to the body's organs. Some examples of visceral structures are the lungs, the heart, the glands, the organs of the gastrointestinal tract, etc. Structure of the nervous system. The neuron is the primary and smallest part of the nervous system. It consists of a perikaryon, which is the cell body, which contains the nucleus and other organelles that form neurotransmitters. The other part of the neuron are the cell processes, which include dendrites and axons. Dendrites are numerous, short, and highly branched structures which carry nerve impulses toward the cell body. Axons are single processes with many branches. They carry impulses away from the cell body. They are referred to as nerve fibers, and they may be myelinated by Schwann cells in the peripheral nervous system, or they may be unmyelinated. Neurons may be multipolar neurons or pseudo-unipolar neurons. All pseudo-unipolar neurons are sensory. Multipolar neurons, however, may be motor or sensory depending on their location. Myelinated nerve fibers are surrounded by concentric layers of membranes of the Schwann cells, also known as the myelin sheath. Multiple cells surround the axon. The speed of conduction of the impulse is related to the myelination. Unmyelinated nerve fibers consist of a thin layer on the surface of the axon. Several fibers are surrounded by a single cell. These are sensory nerves. The structure of a peripheral nerve consists of axons and fibers which can be either motor or sensory. This diagram illustrates the organization of the nervous system from the central nervous system, which consists of the brain and spinal cord, down to the various divisions of the peripheral nervous system. The spinal cord is composed of gray matter and white matter. Spinal nerves have a dorsal root, which attaches to the dorsal horn. The ventral root attaches to the ventral horn. There are many branches of the spinal nerve, and we will not get into these in this class. The relationship of the head and neck. The neck connects the head and the trunk. The esophagus connects the oral cavity to the stomach, and the trachea connects the nasal cavities to the lungs. The image on the right shows a sagittal section of the head and neck. This image shows a frontal section of the head illustrating the various cavities. This is the cranial cavity, the nasal cavity, and the oral cavity. These are the sinuses. Regions of the head include the temporal fossa and the infratemporal fossa. There are many muscles that are associated with these two fossa, and we will be covering those when we get into the muscles of the head and neck. This concludes this lecture on Chapter 1, Head and Neck Anatomy.